Hey everyone, it's Monday. It's another Lunch and Learn, isn't it, Stephanie, right? I'm Dr. Melanie Palm from Artist Skin MD. I'm the medical director here in Solana Beach, California, and Stephanie Williams is one of our amazing PAs. Actually, Julia, my other PA, was our superstar photographer, so thank you for hitting the start button. But today we thought we'd talk about a technology piece, right? Because we're trying to do kind of, short, but I think informative, a little deeper dive than just an 8-second clip about technologies. And it is fall, so people here in San Diego are now, I think, shedding some of their tan, which we don't love them to have a tan. That's a sign of DNA damage. But we do like people to be as lighter toned as what their skin tone normally is for something like IPL. But maybe you can talk a little bit about what does IPL stand for?
Sure. So IPL stands for Intense Pulse Light, and we use it to treat, like Dr. Palm was mentioning, sun freckles, photo damage from after the summer. And we've got specific filters that we use depending on what chromophore we're targeting. For example, dark spots, lentigines, it does a great job at getting after browns, but like Dr. Palm mentioned, you gotta make sure you're as pale as possible because the IPL device is not smart enough to actually differentiate between what is a sun freckle and what is your normal skin. So we do want to just target the sun damage and the pigmentation that we don't want. We want to leave your normal skin alone. So that's why we want to make sure at the fall and winter time, usually, especially living here in San Diego, is when our patients can have that opportunity to be as pale as possible, is what we like to tell them. And then we also have another filter called the vascular filter that we use actually to treat more red spots. So, from sun damage, people get those telangiectasias, the little stubborn red little spider-looking veins right around central face, around your nose. So this does a beautiful job at just, helping treat those lesions so you see more of an even pigment and even skin tone throughout. And then we use it really commonly to treat rosacea, which is one of the common skin conditions that we treat here, as well as acne. So some patients also have some scars that either they pigment with a scar or they look more pink. And so this is a great device that we use really frequently in terms of targeting pigmentation. Yeah,
so frequently daily use that we have actually 2 devices, right? So we're over in one portion of the clinic where we do a lot of research and where Stephanie and Julia see a lot of their patients, and I occasionally do. So we have a standalone one here, but because we have 3 providers here using the IPL device, we've got a really lovely one, M22, we'll kind of talk about that. I think one of the questions we get asked with Intense Pulse Light is well, how does it work? And I think Stephanie did a beautiful job of explaining that. There's a theory of something called selective photothermolysis, and this really responds to laser technology. And I get asked a lot by patients, is IPL a laser? And the answer is no. Laser is, amplified light that's all working in the same direction. The waves are all in sync, and it's a single wavelength. So this device takes light anywhere from about 400 nanometers to about 1200 nanometers, and with the presence of a water filter, that tends to filter out some of the shorter wavelengths up to about 500 nanometers. But then we actually put in different filters. So if you look at our handpiece, which we can grab it so we can show you guys, there's a couple things that we change with this hand device. So right now we have sort of our tried and true filter, which is the 560 nanometers. So this means that anything shorter than 560 nanometers, it doesn't allow through, but it allows 560 and beyond of the light that's actually being emitted from this. And then there's the crystal handpiece, or that we actually adjust. And so we've got a smaller one in here. This is great when we're going around exactly like you were talking around the nose to go after some of the telangiectasias. Areas that are sort of small places. You mentioned after scars, so if we're doing an earlobe repair, or I've done a chest excision, or somebody has a recent breast scar, a tummy tuck scar, or a traumatic scar that we're trying to resurface, sometimes the smaller handpiece is really nice. But the nice thing is we actually have larger handpieces, so I'll show you guys what one of those larger ones looks like. And it's quite large, so this is a lot of surface area. This isn't typically when we're doing an IPL on the face, neck, and chest, or on the forearms. We're not just using it for spot treatment, but we're globally treating an area. And with such a large handprint, which you can see sort of the size of it, and it's actually a sapphire tip, so this is very elegant, in how it's actually being sort of distributed. We're actually able to do a quick treatment. And there's a lot of variances in what we can do and sort of some of the physics of how this laser technology is actually, or laser, IPL technology, see I'm correcting myself, is actually used. So if somebody has a deeper skin tone and we're wanting to be really safe, or they have a little bit of a tan that we think we can get away with, Stephanie, what are some of the things that we do to kind of adjust the settings to make it safe?
As Dr. Palm was mentioning with the different filters, the 560 is our workhorse that we use all the time. If you're pale, if you have a lighter skin tone, but we can actually use the same treatment on darker skin types if we're careful with our cutoff filter. So we'll increase that cutoff filter to maybe like a 590 filter that we can use. And in terms of the pulse duration of what we're using when we're firing that IPL, we can actually lengthen it so that it can actually be safer for darker skin types and still as effective. And then also with the energy that we're using, so we would lower down some of the energy settings, and then also if it's a more pigmented scar or something, sometimes we'll bump it down a couple notches just so that we're not putting too much energy onto the pigment that we're treating. And then we can always adjust things as we go along. If we're treating a scar, we might start with a lower intensity energy, and then as we invite you back for your subsequent treatments, we might slowly start to increase it, just depending how we're seeing it on presentation. So I love it because it's so customizable to different skin types. And then even some of my patients that come in a little more tan than we like, we can actually tweak things just so they still get a safe and effective treatment with our IPL.
Yeah, because what we're trying to see, IPL devices need to see a contrast between your normal skin type and whatever color, whether it's brown or red, that we're sort of targeting in the skin. And so if somebody's more tan, that means their freckles are kind of closer to their tan skin, and it means we either have to turn down the energy or the fluence, that's the amount of energy being deposited per a square centimeter within the skin, which is sort of like our overall sort of numbers we kind of talk about. Or we have to slow and delay how that energy is being deposited over a chain of pulses over time. And so we'll have patients that are like Stephanie's skin tone. It's not pigmentation, which is an issue. Usually we'll select an actual laser, a longer wavelength but quick firing laser to deal with some of that pigmentation. But they'll have rosacea, and we want to treat that. And so we can do targeted small areas with appropriate fluences using sort of a slightly longer wavelength filter and really be safe. Now, this comes with like 6 filters. We don't use the ones for laser hair removal because we're very lucky. We have a lovely Splendor X dual wavelength Alexandrite and ND YAG laser, which maybe we'll talk about in another post. And there's some other ones that are helpful for deeper veins. So, occasionally we'll use some of the longer wavelength ones for that. I am not a fan of treating leg veins with this, so I'm sure you've had patients that have come in most of the times when they've been treated by either an IPL device or a laser for some of these things. It's quite painful, and it doesn't adequately treat. I tell patients it's kind of treating the leaves, it's not treating the branches of the vein issue that's going on. So in most cases, the gold standard is sclerotherapy or some sort of intervention that's actually addressing the abnormal vein. So we love this for photo damage, like you were saying, for rosacea. But there's a couple of other instances where we use this quite a bit, and one of them is with something called photodynamic therapy. So tell, who is like a typical candidate that you're seeing in clinic that you're talking to about
So photodynamic therapy, so we do a lot of skin checks here as well because we're a derm office, so myself and Dr. Palm. And sometimes some of my older patients said that they got a lot of precancer lesions that were using liquid nitrogen, and I always say if I'm freezing more than 5 actinic keratoses, which are the term for those precancer lesions, in one area, especially in the face, that would be a candidate for photodynamic therapy, which is we're using sensitizer, photosensitizer, topically solution that it actually goes after precancer. So we have you soak in that photosensitizer for depending what we're treating a certain amount of time, and then we expose that to 2 different light sources. The first being this IPL device, and the second one is blue light actually. So you sit under blue light, and that is so effective in terms of treating those precancer lesions as well as helping even out the skin tone, so you get that cosmetic benefit as well in terms of just not seeing so much redness, because sometimes those actinic keratoses, they're red and scaly and they're rough. And so the way we couple this together with those 2 light sources, we get the benefit of doing almost like 3 separate photodynamic therapy if we did it separate without the IPL, but it's so effective because you just do it once, and then you don't have to go through all that downtime multiple times, you know, a month apart with that photodynamic therapy, how we do it here. So it's really, really effective, and most of the times we do also pre-treat with a topical prescription chemotherapy cream to help target those actinic keratoses prior.
And there's studies to support that. So photodynamic therapy is a light plus a chemical-based reaction. So we're putting a photosensitizer, in this case aminolevulinic acid here in the US, and it soaks into oil glands. It soaks preferentially into cells that are turning over more quickly than other cells. So precancerous cells, actinic keratoses, are turning over a little bit more quickly. And we do typically on the face something called short contact. So there are studies to support doing just 30 to 60 minute incubation. So we put on the solution, we put on topical numbing for an hour or two, so it's really comfortable for patients. Because if you speak to patients that have had blue light therapy in the past at typical sort of locations, under typical sort of protocols, it's very uncomfortable for people. So we do a lot of things to have comfort measures for them. And then we expose you to 2 light sources, as Stephanie was mentioning. And the purpose of the IPL is to catch some light bands that excite this chemical that's on our solution to selectively destroy certain cells, including these precancerous cells, with something called Q bands. And so that's why we use an IPL technology to activate that. But we also get the benefit of treating the sun damage, treating the broken blood vessels, building collagen. So you get the benefits of 2 or 3 IPLs, and this is actually substantiated and written in the medical literature. When we do PDT with IPL as one of the photoactivating sources. The blue light, which is around 417 nanometers, it strictly activates the solution to go after precancer spots. So it does nothing to help with photo damage. So if you've had patients in the past that have done 60-minute incubation, done just blue light for the 17 minutes, they say it hurts like heck. And it maybe cleared up some of the precancer spots, but their skin quality doesn't look any better. And so they usually recover a lot more quickly than how we do things in our office. But the blue light captures something called the Sorit band, which is the biggest sort of peak that we see in photoactivation when we're putting this solution on your skin, this chemical, and then activating it with a light source. So I like trying to activate all of these different sort of bands, with the Sorit band, with the blue light, and the Q bands with the IPL. And then when we're combining this IPL, we're cleaning up so much more of the sun damage. So we know we're building type 1 structural collagen. We're helping the health of the skin. We know with rosacea skin, you're prone to these little mites called Demodex mites. We know from literature where they've actually taken a look at the skin sort of after treatment, we're frying those Demodex mites. We're helping with inflammation. And then we're cleaning up, like you were saying, some of the sun damage. So if we do this PDT with IPL and blue light, we're very real with what recovery is like. So I usually explain it as patients are going to look like a red, slimy, roasted tomato for about a week. And I really say that not to scare people, but I think we want to be realistic. This isn't a walk in the park. I think it's like, women getting pregnant and giving birth. They they're happy they have the baby. Patients are happy with their skin after the PDT, but we're very realistic with, I think, what the recovery is. But tell me like what that conversation is like with you when you're talking to patients about it.
Oh yeah, I mean we do such a good job in terms of patient education. I think we just really make sure they know what they're getting themselves into when they sign up for this procedure, because it is a lot to ask of you guys. I mean we make sure we prevent everything we can for prophylactic in terms of antiviral, antifungal, antibacterial. There's definitely a regimen that you have to do after in terms of like the soaks, and there's certain products that we have, for example this nectar that we have them use to help them heal, and so it is a lot to ask in terms of the aftercare, because like Dr. Palm was mentioning, you're going to be like a slimy tomato for about 7 to 10 days and red, and so usually patients want to pick a time where they can hide out
a little more quiet at home.
Right, so we've got the holidays coming up. I think Thanksgiving break, some people have some downtime between Christmas and New Year's. I think this is a perfect time for people to do something like this.
So let's talk a little bit about nectar, because anytime we're doing IPL or we're doing any sort of light treatment, we really, as standard of care, recommend doing this regenerating skin nectar by elastin. And so it's got the trihex technology. We talked about this on it at the last clip that we were actually doing with Ricky when we were talking about Body Transform. It's got the trihex in it, but this has got the tripeptide, the hexapeptide 1 and 2, and what this has been shown is if you pre-treat, so we usually recommend if patients have advance notice, we like them to start using this 2 weeks, whether they're getting just straight up IPLs, IPL with a non-ablative technology, which we'll talk about recervix, or whether they're doing PDT, because it prepares the wound bed. It helps down-regulate things that can be sort of destructive to our skin, so matrix metalloproteinases and other things that are inflammatory mediators, and prepare a wound bed so that we're in sort of an anabolic phase. We're actually growing good collagen, we're growing good elastin. So within 3 weeks of using this, it's been shown by skin biopsies at baseline and 3 weeks afterwards that we're actually helping to restore the skin, giving it a healthier sort of epidermis and dermis, how it's talking to one another, and the structure sort of recycling itself a little bit. And then another thing we like to do immediately after treatment, it has become our gold standard, is something called CMT creams, and that stands for, the C stands for chemical peels, the M stands for mechanical, things like microneedling, which you and Julia do a ton of, and then T is thermal, which is in our case talking about things like laser and light treatment. So when do you have patients apply this?
So we actually do it immediately after an IPL in office, and after microneedling, or like Dr. Brown mentioned, any kinds of chemical, mechanical, thermal, even like chemical peel, and it just brings down the redness immediately, pretty soon after. It cuts that downtime, and then it helps with that, like, any discomfort you might feel afterwards. Like some patients notice like a little sunburning sensation after microneedling, after any thermal injury that we're doing pretty much essentially causing with this IPL, and so it just helps with the downtime and the recovery so much faster, and patients just love using this after ever since we've incorporated it.
And its key ingredient is these neuropeptides. So it actually has small proteins that affect our sensory nerves. So immediately after we do many laser light, microneedling procedures, we get a slight, increase in inflammatory mediators. We probably get histamine release, we get different things that cause redness, swelling, and discomfort. And those are the three main things that when this was clinically studied, it helped improve. So patients notice within about 10 to 15 minutes that if they do have like a burny sensation on their face, that is much, much, much better, if not relieved. And then when I've had patients that have been doing IPL, and we'll talk about something called recervix, which is a non-ablative infrared laser that helps with collagen remodeling and skin texture. I've had patients doing that close to 10 years, and we introduced this into our practice within the last quarter or so. And I have had probably 10 patients text me and say, I don't know what's in that magic sauce, but it helps so much. The downtime I've had in terms of redness and swelling is halved, and it really helps them in terms of sort of just comfort, and they like the way it feels. It's got a really nice, not tackiness, calming, and just feels really good on the skin too. So we have patients use this just immediately afterwards. We apply it literally right in clinic. If I'm doing a face, neck, and chest, we apply it to the face as I'm doing the neck and chest. And then we have patients usually do it 2 to 3 times a day with what they can do comfort-wise for a couple days, I would say, afterwards. But maybe we'll switch gears. When we're doing IPLs, we've talked a little bit about just using that standalone, and we use it in many areas: face, neck, chest, back of hands. Yes.
Some patients get those, we call them benign skin growths, those seborrheic keratoses, those little tan brown spots that they don't like just from sun damage, and even lentigines. So I've done like full arms, back of the hands, is where patients notice the lentigines, and even length.
And is it a one-off, or do we usually recommend a series of treatments?
Absolutely, that definitely a series, and depending on how many you have and how dark they are. Off the face, I usually recommend at least 2 a month apart. On the face, we start at 3 a month apart. Is that about
and then I think a couple things to really talk about is like the first time you have an IPL in a given area is always the most dramatic. So you will see brown spots, you'll get little coffee grounds, and they'll sort of peel off. And sometimes I'll have patients say like, I didn't peel, I didn't get as many coffee grounds. I mean, once your skin is in a good point, and if you're in maintenance and you're getting an IPL quarterly or maybe once or twice a year, which we'll talk about the benefits of that, you don't necessarily get that same response. You do not have to get crusty to see the benefits of IPL. And I think that's a really important myth to dispel, because I think sometimes people feel like they have to get to a point that they're either feeling pain, which we do topical numbing, and I think we're always paying attention to what the skin looks like and how the patient is responding to things, but it makes it so much easier than
Absolutely.
many practices that select not to do IPL
No
numbing beforehand.
I've heard that so many times.
Yeah,
I'm like,
I
oh
just,
my gosh.
it's such a difference, I think, if you do
Absolutely.
topical numbing, and the numbing we select, I think, is really helpful for that. But, you know, you want to do this as a series of treatments because there's an additive effect. If you look in the clinical literature, when there's been IPL studies that have been done, it's typically 4 to 6 sessions,
Yeah.
spaced about 3 to 4 weeks apart if it's on the face. Sometimes we do a little bit longer if it's all
Right.
face because that heals a little bit differently. But interestingly, we know if you do this at least annually or twice a year, you are changing skin biology. So you are actually down-regulating inflammatory sort of mediators and up-regulating things that help to build good, healthy structural collagen. So I've got patients I can think of that I've been treating for a decade. Some of them are couples, and their skin looks
Absolutely.
younger a decade
yeah.
later than when I started with them, you know, 10 years ago. So I think we know not only that, but more recent research that was just presented at a summer meeting I was at, we know when we do laser and light-based treatments, we're actually helping the skin microbiome. So the healthy bacteria that's on our skin that through environment, through our diet, through just life changes are changing to not such a great mix of bacteria, we can get them back to healthier mix that is beneficial to our skin with regular laser and light treatment. So I don't want this to be something you do a series and you forget it.
Yeah.
You really, like, once you get to your last one, we should be seeing you every 6 or 12 months to do a maintenance treatment to help with that prolonged benefit that you're getting over time.
Definitely.
So maybe explain a little bit about Resurfix, because I would say like 70% of patients we do IPL on. Also
Yes,
on this
we add it
platform,
on.
we have Resurfix.
Yeah, so this device is so unique because we have 2 different hand pieces. So as you're in the office, if you wanted to add a little extra treatment to help with collagen stimulation, helping with fine lines and wrinkles, skin quality and texture, this, as Dr. Palm mentioned, is a near-infrared, non-ablative laser, but it's not within the visible light range, so you can actually do this procedure without those goggles. We actually do it without anything.
We always recommend sort of safety with
right,
that, though.
but you can close your eyes.
Yeah.
But this creates little columns of heat into the skin, and so it helps build collagen over time. And really common to do, you know, the same time with IPL, we couple it together because it adds about another 10-15 minutes to the treatment. And so we do it also to treat acne scars. That's a really common thing that we use, and even like regular scars you can use it for.
Yeah, so it's, you know, it's considered, this is very similar to Fraxel, which is the original sort of studied wavelength, 1550 nanometers, that's used as a fractionated, so almost like aerating a lawn. This runs along the skin and creates little pixelations and columns of heat energy from the near-infrared sort of light that's administered from this. In this case, on the Resurfix platform, it's 1565 nanometers, so very similar. And it's done as a series of treatments, and that heat stimulates collagen, the triple helix, the 3 structures of collagen that are bound together. They denature a little bit, and it causes new collagen growth. So when we get to this sort of happy temperature, we can create new collagen in the skin. And so when we create new collagen, like Stephanie was saying, we help with sort of you know, skin texture. So pore size, mild acne scarring, mild wrinkles, skin textural irregularities. We love to get after scars early. So actually when I'm doing some elective cosmetic surgeries at the time of suture removal, I will actually run over the areas with the IPL first to pull out pink and or brown, and then use the Resurfix to help sort of lay down more normal collagen. It can be used in many areas. So, you know, most common I would say is the face, but we use it a lot on neck, on chest, back of the hands, scars, to help remodel. And it's, again, should be done as a series of treatments with periodic maintenance. One of my favorite things to do is actually skin cycle a little bit. So oftentimes we'll do something like Resurfix, and then we'll sort of alternate that and do something like microneedling with PRF, and then go back to that. So we're doing something sort of heat-based that's building the collagen, and then doing something that's a blood product that's kind of your body's own fertilizer with something like mechanical disruption with the microneedling. And again, similar to the IPL, we can do this at the exact same time. So we do the IPL first, that takes about 7 to 10 minutes on the face, and then we do the resurfix, which takes about 10 minutes. We have patients with either laser goggles on or eyes closed, because obviously we want to be really careful with laser technology and eye safety while we're doing that. And then, you know, in terms of sort of recovery, when we're doing resurfix, what do you tell patients in terms of recovery time?
Yeah, I think after resurfix, I think most of my patients are a little pink. They might look a little sunburned, might have mild swelling, but with the CMT cream that we're using, that downtime's cut down pretty significant. Used to be, I tell patients like 7 to 10 days, you might be a little pink. The worst being maybe the first 1 or 2 days, but I think the feedback we've gotten since we're doing the CMT, it's like literally the next day they can just put makeup on, really not really, a super low downtime.
So with, you know, something like microneedling, which we're not necessarily talking about today, we don't want to apply anything other than straight up hyaluronic acid for 24 hours. But the nice thing about doing IPL and resurfix is this isn't ablative technology. It's not creating holes in the skin. And so we can actually, you know, we apply nectar, we apply the CMT, and then we can apply sunscreen, but patients can apply makeup right afterwards. The next morning they can actually do that. So, you know, I mean, I will have Stephanie or Julia do this on my own face, and it's a Tuesday or Wednesday night, and I'm here, you know, Wednesday or Thursday the next morning, and I'm seeing patients, and you wouldn't think that I was a bad science project. So I do think it does, you know, become, I think, easier over time in terms of explaining how it feels. I think the IPL, I explain to patients, it's like a bright light going off in the room and a little bit of snappy heat sensation. Very doable, especially with the topical numbing that we do for the vast majority of our patients. And then with the resurfix, I think there's, you know, areas I don't feel at all on my face. You know, occasionally here and a little bit at the perimeter of my forehead, I feel it a little more. And to me, it feels like almost sparklers on the 4th of July hitting my skin.
Like a little electrical current almost.
So different feelings. You know, most patients give us feedback that they think the resurfix is even easier than the IPL.
I've had it split 50-50, but it's really well tolerated.
So, you know, this becomes, I think, popular things to do as we go into fall, winter, and early spring, because it's, the weather is cooler, the daylight, we just had daylight change, and it's shorter days, you know, so these are popular sort of procedures for sort of getting your glow up during the holidays, which we're quickly approaching. And thinking about, you know, getting yourself into sort of a series of treatments and then maintenance therapy. I think first and foremost, we're really appreciating it. It's so important to the skin biology and health of your skin. So any sort of final tips or secrets that you wanted to share with the audience?
Oh gosh, it's hard to think. I think what Dr. Palm was mentioning in terms of the timing for these procedures, we counsel you guys after any lighter laser, we want to make sure you avoid direct sun exposure for at least 2 weeks after. So this is a nice time, because I know we have a lot of surfers and my runners, my pickleballers, they're outside in the sun. Now that our days are getting shorter, it's a great time to take advantage of this time of the year, because then they're able to adhere to the aftercare instructions and just making sure we get you the best results possible. So I think this is a really popular time. And then again, with the photodynamic therapy piece, with the recovery, I think this is probably our busiest time when we do PDTs annually.
Well, we want to thank you guys, and I think something that we really take seriously is sort of the investment in skincare that you're doing at home. So oftentimes if people are sort of thinking about doing an IPL resurfix as sort of skin color and textural improvements, or we're doing something like PDT to help with precancerous spots and sun damage, we want to make sure you're protecting your investment after you're doing some of these procedures. So you know, that's probably like a future broadcast we'll do, where we talk about, you know, what are the basic tenets and sort of layers of pyramids of good skincare, because that includes things like good sunscreens, making sure we've got you on something that's turning over the skin, protecting you with antioxidants, and then adding other cherries on top of, I think, the sun care and skin care Sunday to really help with things. But we've got lots of oodles we can talk about. I want to thank Stephanie Williams so much for sitting down with me and talking about a very beloved device so much that we've got 2 of them here in the office. We're very fortunate to have that. But it really is, I think, a daily use machine here in the practice for just keeping our San Diego skin really glowy and lovely. So if you have more questions, you can look at our website. It's artofskinmd.com, and you can give us a call at 858-792-7546. And I'm going to do this the old-fashioned way, and I'm going to stop our own video. But we want to thank you guys so much for tuning in, and we will see you guys next time.